UltimateBaseballStrength.com. Thanks for stopping by. Today I want to talk to you about how to prevent the dreaded elbow injury in baseball. Elbow injuries in baseball, they're common, especially in pitchers, and they can range from various degrees of just a little nagging to complete reconstruction. Tommy John surgery specifically is when the UCL, or the ulnar collateral ligament from the medial side of the elbow, that's the inside of the elbow, is actually replaced by a tendon. And it's a surgery that actually is demonstrate a lot of success, but we never want to take that chance, and we always want to try to prevent surgeries in the first place. So the idea today is for me to give you an idea of how you can go about that and how we keep our baseball players' elbows from getting injured in the first place many times. So first thing to consider is that when you throw a ball and you extend your arm, you're using the tricep muscles, and that's going to be a subject for another day. But the antagonistic or opposite side is the bicep, and the bicep is made of two heads, okay? And the function of the bicep muscle is to flex the elbow and also pronate and supinate the forearm at the wrist, okay? So it's a dual purpose muscle. But the brachialis, which is the forearm muscle underlying it, it originates at the distal half of the humerus, which means the bottom half of the bone in your upper arm, and it inserts down in the ulna, one of the two bones in your forearm, the radius and the ulna. So it has a big tendon at the end of it, and it's nice and strong, and the only function of your brachialis is to flex at the elbow, shorten the bicep and flex the elbow. So the thing is many baseball players they'll work their bicep and they'll do the tricep and everything, but they neglect to work on the brachialis, and the brachialis serves the purpose of giving a reinforcement in the elbow joint. So you want to have a nice strong brachialis, and to work the brachialis, you just keep your hand in a neutral position. Instead of curling a dumbbell with your hands up, you just have your thumb up and you curl, just shortening at the bicep, and the brachialis kicks in. And that little simple move is going to do wonders for preventing future elbow injuries and elbow pain, as long as you keep a balance between the bicep, the brachialis, triceps, etc. So anyway, if you have any questions, post them on the blog, and we'll see you next week.